I am Dr. Sabine Elisee. I'm a board-certified family medicine physician. I'm the CEO and co-founder of Cornerstone Medical Group here in Coral Springs, Florida. And there's something I've come to realize. As a physician, as a pastor's kid, wife, and mom, I have come to realize to be healthy and well, you cannot just address your physical health. No, you have to address your physical, spiritual, and emotional cognitive health. That's why I help men and women reconnect their physical, spiritual, and cognitive health to bring satisfying wholeness to their lives daily. And I do that here in Coral Springs, Florida at Cornerstone Medical Group. So we are talking today about colon cancer, colorectal cancer. Go ahead and write that down. You know I'm all about educating. I want to make what we're talking about very simple and very clear. So go ahead and write down that number or that name, colorectal cancer. That's what we're talking about today. And we're going to have a really quick discussion. So some of the facts about colorectal cancer. Number one is that our screening allows for this to be preventable. As a family medicine physician, one of the most important things that we could do is help you understand what is preventable. So we always want to go for and speak and really give you the answers beforehand of what is preventable. And one of those things that we do is that we do that with screening. So here are some of the number of things that you should understand and know. 60%, that's 60% of deaths that are related to colorectal cancer are preventable. 60% of deaths that are related to colorectal cancer are preventable. And how are they preventable? Because we do the screening. We do the screening beforehand. Here's another fact. Colorectal cancer, that's colon cancer, is the number 2, drop a number 2 in that comment line, the number 2 leading cause of deaths combined in men and women. Colorectal cancer is the number 2, that's the second leading cause of death in men and women combined in the United States. All right, these are some striking numbers. 1 in 20 individuals are diagnosed with colorectal cancer in their lifetime. Here's another thing, that 1 in 3 people, right? So we have a couple of people in the chat right now. I'm looking at just 3 or 4 that are already, that I could see just on the screen here. And it says 1 in 3 people are not up to date with their colorectal screening. And of the individuals who actually have colorectal cancer, one of those individuals have a family history. So you see these numbers are striking, and that's why it's so important for us to really get an understanding of what we can do to protect ourselves and protect our loved ones. So as a family medicine physician, the number one thing I'm going to tell you is that you have to go for your screening. When do you go for your screening? 50 years of age to 75. 50 years of age to 75, that's when you should be going for your screening. And we're gonna talk about 2 screenings in particularly today. We're gonna talk about the FIT test, where we do the stool sample, and we're gonna talk about the colonoscopy. And you all know already that I'm talking to you more so about the colonoscopy today because this is my push. I want you to get your colonoscopy. So that should occur starting at the age of 50, going all the way to the age of 75. Individuals who are African American, you should be getting your screening at 45 years of age. Why? Because we have found that for some reason, colorectal cancer is occurring at a younger age in African Americans, and it is more aggressive. So 45 years of age is when you should be signing up for that colonoscopy to get done. So what are our risk factors for colonoscopy? I want to name 5 risk factors, and I want to point out that only one of those risk factors you cannot control. That means the other 4 you can control. Number 1, we cannot control our family. So our family history is associated with increased risk for colorectal cancer. If you have a family history, you have an increased risk of colorectal cancer. Number 2, another thing that is increasing the risk of colorectal cancer is if you have a high-fat diet. High-fat diet, of course, is associated with being overweight. So high-fat diet increases your risk. Processed meats increase your risk. So my parents out there who are making those lunches and putting those processed meats inside our sandwiches for the kids, Let's cut back on that. All right, so processed meats increase our risk. Tobacco, smoking, that increases your risk. High consumption of alcohol. I'm not talking about the social drinker. I'm talking about that individual who tends to get wasted on the weekends or even every day. High consumptions of alcohol increase your risk for colon cancer. And then, of course, we mentioned the family history. So I've named 5, and only one of those things you cannot control. But you can control the amount of a fatty diet you consume. You can control the processed meat. You can control your tobacco use. You can control your alcohol use. So it is so very important. This is why we talk about 60% of those deaths that are related to colon cancer, they are preventable. So those are 4 things that definitely you can prevent, and those will decrease your risk if you are any of those individuals. You are someone you know are engaging in any of those activities too much. So we have colorectal cancer we're speaking about. Again, we said this is the #2 leading cause of death in both men and women combined in the United States. So what is most important right now is the screening. We are in colorectal cancer month in March, and now we want to talk to you about a screening. I will be quite honest with you. When I first started practicing medicine years ago, and I would have my patients who would come in and say, you know, Dr. Elisee, I really don't want to go for this colonoscopy. I would just kind of say, all right, fine, let's just do the stool sample and we'll just check it every year. And now, I'm pushing back on that. I'm pushing back, and I'm challenging all of my patients, as I'm challenging you today, to really get that colonoscopy done. Again, if you're African American, that's at 45 years of age, and otherwise it's at 50. And then if you have a family history of colorectal cancer, then that should even be occurring even earlier. And you'll speak to your physician so that they can tell you exactly when. So what is the difference between these most common two screening modalities? The stool sample is just the stool sample. Your physician will give you a card from the lab. You have a bowel movement and you take a sample of stool, you put it on that card, and then you bring it back to the lab. And in that sample of stool, what they're doing is that they're actually looking for any evidence of blood. Now, here's the problem with that. If we take that stool sample and the blood is on this side of the stool and not on that side of the stool, and I take the sample from that side of the stool, that means we will never know what's going on the other side of the stool. And that's why that FIT test, the stool sample test to do the screening for colorectal cancer, no, it's not as good. It's not as good as that colonoscopy. Get that colonoscopy done, again, because depending on where we take that sample, it may or may not show the evidence of blood in the stool, and that is an indication that something is going on in your colon that shouldn't be going on. You know, I hear a lot of people talk about, hey, should I do a colon cleanse? Should I do this? Should I do that? I want to talk about gut health. This is the most important thing that you could do for your gut. Get a colonoscopy. Again, 45 years of age if you're African American, and then of course 50. And if you have if you have a family history, then you want to get that colorectal cancer screening, that colonoscopy done even earlier than that, based upon the age of when that family member was diagnosed. So here's the colonoscopy, and this is what I love about the colonoscopy. It is both a screening and a treatment modality. Right? That's 2 in 1, screening and treatment. That's what's so great about it. Why? So 1, we do the screening. You're 45 years of age, you're 50, or if you have a family history of it, you go in there earlier, you spoke with your physician, you go in and you do the screening. You go, they do the colonoscopy. They look with the camera and see every little twist and turn of your intestines. And while they're in there, if they see anything that does not look like it should be there, they go ahead and take it out. They just go ahead right there and take it out. You hear that? You don't have to come back a second time. You don't have to do anything else. Right then and there, when you signed up for your colonoscopy, for that screening, if there's something that's not right, they go ahead and take it out. So this is what I love about this dual modality of the colonoscopy. And then from there, they'll just go and take whatever they take out, and they'll go and test it, take it to the lab, and actually see if it has any indication of a cancerous history. I want to share something with you that happened with one of my patients because I think this is very important. I had to do that push recently with a patient of, hey, go get this colonoscopy done, go get this colonoscopy done. Thank God that she did. She had her colonoscopy done. They actually found what we call polyps. So right then and there, they removed it. They went and removed the polyps. The polyps did show it was an aggressive type of cancer. Immediately, she was able to go and have surgery. She was diagnosed with colon cancer. She was diagnosed with colon cancer. She went and had surgery, and she recovered completely well. She recovered fine. So what would have happened if she didn't really believe her physician and take the time to get that colonoscopy? Then today, there would have been a daughter without her mother. There would have been a husband without his wife. And there would have been a grandchildren, because she had many grandchildren, without their grandmother. And it's just not worth it. You know, she was pushing back initially about this colonoscopy because all of us have these myths and ideas of what a colonoscopy will entail. But afterwards, she was so thankful. So if there's anything that I want to encourage you all to do today in our discussion today is get the colonoscopy. Go ahead and get it done. And the beautiful thing about the colonoscopy is when they do it, and if everything's fine, you don't have to worry about it again for another 8-10 years. Isn't that wonderful? Just get it done. We're talking about gut health today. I want you all to get your colonoscopy. Again, 60% of deaths, 6 and a 0, 60% of deaths that occur secondary to colon cancer is preventable. How is it preventable? Again, we get our screening. And we're not just going to rely on the stool sample. No, we are going to do our dual modality of a screening and a treatment with our colonoscopy. So that is the information I want to share with you. I love empowering you about your health, letting you know what's going on in your body, why it's important. I'm just not going to sit here and tell you do this because I'm the doctor. I want to explain to you and help you understand why this is important. So again, 45 for African Americans, 50 and general population screening. And if you have a family history of colon cancer, then your doctor will be able to tell you exactly at what age that needs to be done. All right.